differential diagnosis and just a diagnosis.
Oh, very good. So the question, the difference between DDX, differential diagnosis, and diagnosis. Diagnosis would be the Chewa, and differential diagnosis the Chungwa. Kepshu. Yeah, are you doing, you're doing, yeah, you know this? Yeah? So within the big area of diagnosis, we have a smaller concept or thing called differential diagnosis. So differential diagnosis comes at the beginning, when we're starting our investigation. When we first see the patient, okay, and we have all these possible diagnoses. Then we do all our work, okay? We do a history, we talk to the patient, get symptoms, then we do a physical exam and we find signs, right? Things we find on physical exam. We do our laboratory studies, x-rays, blood work, urine, okay? And then with all that, we can exclude some of the members of our differential diagnosis. And we narrow it down to a final diagnosis. So you could say that the differential diagnosis is kind of our working hypotheses at the beginning. And then we collect a lot of data and we narrow it down to one, sometimes two diagnoses. Great. Please, anybody else have a question from yesterday? So far I haven't coughed. Let's see. Let's see how good Kaser is just taking one dose. You have to take many, so I just took one. Questions? Some things that are not clear, concepts or words or anything, just whatever you have in your mind. Please feel free. Yes.
How do you see a cough? It's as a disease or a symptoms?
Cough.
Yeah.
Yeah. What do you think?
I think it's a symptoms.
We would call it a symptom, yes, because this is subjective. So the patient says, "Doctor, I'm coughing." Okay. You might call it a sign, because the doctor could observe it during the physical exam, but generally we call it a symptom. Symptom is more subjective. You know, it's what the patient tells you. Doctor, I have headache. Symptom. Doctor, I'm coughing. Symptom. Doctor, Jampanasayu. I have a cold. Symptom or symptoms, right? Or doctor, I don't feel well. Symptom. Okay. Or doctor, I'm not sleeping well. Symptom. Or doctor, gupa gup, I'm vomiting. Okay, symptom. Okay.
And how about the headaches and diabetes?
Headaches and
Diabetes.
diabetes. So what do you think? What's headache?
In our case, we say it as symptoms and not this.
Both headache and diabetes?
Yeah, both.
Right. So from a modern medicine standpoint, what do you think?
It must be symptoms.
Well, headache would be symptom.
Yeah.
And then did you say diabetes?
Yeah.
Yeah. So what is diabetes? It's good.
Yeah.
Sorry? Sugar disease, yes. So is it a symptom or what is it? Diabetes. What is it? A symptom or what? Huh?
It is a symptom.
Think it's a symptom. How many people think it's a symptom? Raise your hands. Just honestly, what do you think? Is it a symptom? Raise your hands. Diabetes. Okay, we have one hand. Okay, what is it? If it's not a symptom, what is it? Disease. How many people think it's a disease? Yeah, so we would call that a disease. Diabetes. It would be after you collect all your data, you talk to the patient, and the patient says, yes, every night I'm getting up 4 times to pee, Chimpatang. And I'm drinking a lot of water. These are symptoms. And the doctor thinks, oh, maybe the person has diabetes. So let's do some laboratory tests. We do a blood test for fasting blood sugar. Okay. We may check the urine for sugar. And we may do another test called it hemoglobin A1C. It's a little bit newer, but it's actually the best test for Chininasa. Hemoglobin A1C. It's not hemoglobin. Okay, the other name is glycosylated hemoglobin. Glycosylated means sugar. So some sugar actually binds to the hemoglobin and it stays there for 2-3 months. So it's a very good test for diabetes called hemoglobin A1C. So if we do those tests and they're elevated, they're high, we make the diagnosis of diabetes. Very good, very good. This is good. Other questions? Or other things you're just a little bit, that were confusing or want some clarity? Please.
Sir, yesterday you talked about the degenerative. So is it a conditioning cause or it's a disease?
Okay, very good question. Degenerative or degenerating, what do we also say? Tissue destruction or tissue, sorry? Breakdown, yeah. Tissue breakdown. So these would be more pathogenesis. We're not to the stage of a diagnosis yet. But let's say we collected data. Let's say someone says, I have knee pain. Knee pain, what is that? Is it a symptom? Is it a diagnosis? Is it a sign? What is it? Doctor, I have knee pain. Symptom. Right. Anybody think it's a symptom? Raise your hands. Yeah, it's a symptom because it's subjective. It's what the patient says, Doctor, I have knee pain. Okay? So then we investigate. And one of the things we might do is an X-ray. Or these days we may do CT or MRI, a fancy X-ray, okay, with more precision. And on that we find some abnormalities. Okay? Then we come to the diagnosis, and let's say it's an older person. We come to the diagnosis of degenerative joint disease, or the other name is osteoarthritis. So in that case, it's a diagnosis. Degenerative joint disease would be a diagnosis. Whereas just in general, degenerative phenomena or degenerative process would be a pathogenesis, like a cause. Okay? Is that clear? Great. Great. These are not so easy, yeah? These are a little bit confusing, and sometimes they're not perfectly clear. There's some overlap. Yeah.
So we can say that degenerative is a cause of like some other disease, like osteoarthritis.
Correct. Correct. We can say that degenerative process is a cause of degenerative diseases. So one is osteoarthritis. What's another one? We talked about it yesterday. The old person that's forgetting.
Alzheimer's.
Yeah, Alzheimer's. Or the general name is dementia. Alzheimer's is one type of dementia. Exactly. And that's a degenerative disease of which organ? Which organ? Brain. Brain. And in fact, when we do an MRI on people with dementia, we often find their brain is a little shrunken. The cortex, the outer 2 centimeters, is a little bit shrunken. It's smaller because the brain is degenerating as we get old. Okay, more faster in some people and slower in others, but degenerating. Okay, good, very good, wonderful. Yes.
Okay, so differential diagnosis means the process of differentiating the two or more similar conditions for a disease.
Yeah, exactly.
So in some disease like we call it silent killer, like
I'm sorry?
hepatitis and...
What do you call it?
Silent killer.
Silent killer, yeah, okay.
Where in that case there are no any symptoms or the patient doesn't feel anything.
So it's silent, yeah.
So in that case what you do, is it the same process as before or is there any other?
Process for differential diagnosis?
Yes.
Same process. So sometimes, let's say the patient comes in unconscious, car accident, or they have diabetes, they're a young person with type 1 diabetes, and their sugars are really, really high, and they come in unconscious. We can't get a history from people like that, right? So we can't tell about symptoms, right? But we can examine, we can do lab tests. So in that sense, same process, but we just would not have the symptoms. Correct. Very nice. Somebody in back. Question, please. Wonderful.
Hello, sir. Good afternoon.
Good afternoon.
I just have a simple question.
Yes.
It's just a doubt, I think, my own doubt.
Good.
Why
Good.
there isn't a cure for common cold? Since
Very
it's widely
good.
known.
Very good. Wonderful question. You remember we talked about infectious diseases? And that came under the category of categorizing disease based on cause. Okay? And in terms of infectious disease, we have BOO, or different kinds of organisms: bacteria, virus, fungal, and parasite. So the common cold is caused by a virus. Okay? We're not very good at treating viruses in modern medicine. We have some medicines for viruses. We're getting better. For example, now AIDS is becoming a chronic disease. People don't die of AIDS anymore. In developed countries where they have money to buy the antiviral medicines. In places where there's a lot of poverty and they can't get those medicines, they will die. But if they can get the antiviral medicines, then AIDS becomes pretty much of a chronic disease. People aren't dying so much from it anymore. So that's one area where we've developed pretty good antiviral medications, AIDS. Second is hepatitis. So there are now some treatments for example, hepatitis C, which is a silent killer, okay? But they're very, very expensive. One tablet costs $1,000 and you have to take it for 3 or 6 months, right? So very few people can afford it, okay? For other things like the common cold, we don't have any medication for it. People are working hard, but we haven't found anything. Some viruses we can prevent. And how do we do that? How do we prevent them? Yeah, good. Yeah, so, don't spread it from someone else. You're wearing a mask or something. Good, good. What else? What else helps prevent some viral disease like influenza? How do we prevent it? Flu. On a public health, not just one person, but on public health, whole community. How do we prevent flu, influenza?
Clean environment.
Who said that? Yeah, exactly. Very good. What else?
Living a hygienic life.
Hygienic life. Very good. What else? What? Food and behavior. Food and behavior. Exactly. Even in modern medicine, that's important. I know it's very important in Tibetan medicine or in Sowa Rigpa. What else? You know what His Holiness the Dalai Lama has on his upper arm? He has 4, what are those? Vaccine. So we have vaccines to prevent influenza. Okay? Since influenza, the virus, the strain changes every year, we need to change the vaccine every year, so they're only good for a year. Okay? But we have vaccines. Okay. But for the common cold, we don't have anything in modern medicine. Just for the symptoms. Reduce the cough, reduce the phlegm, the mucus, reduce the fever. But otherwise, we don't have anything. So just symptom control. If you find a treatment for the common cold, you'll get a Nobel Prize in medicine. Good. Any other questions? Question? No. Scratching. Yes, please.
Good evening, sir.
Good evening.
My question is, how would you classify addiction into what do you consider addiction to be like, is it a disease or
Hmm?
is it what do you call it?
Okay, very good.
Addicted, not
I-
necessarily to substance, but
Uh-huh.
to like
Any
behavior.
behavior.
That too. Like, what do you call it? Like, is it a disease or what?
Sure. So addiction to, you said behavior?
Sometimes there's this thing called kleptomaniac.
Uh-huh.
Yeah,
Yeah.
they tend to steal things. So
Yeah.
would you call it a disease or
Uh-huh.
like? So I don't understand what kind of
Category.
area or
Yeah.
category would you would put it in?
For addiction.
Yes.
Yeah, very good. So is it a symptom? Is it a symptom? Probably not. Probably not. It might be. I mean, if the patient came into the doctor and said, "Doctor, I'm addicted. I'm addicted to stealing things. I'm a klepto." Yeah, then you might call it a symptom. Okay. Most likely it would be a diagnosis. Okay. But then we'd have to be more specific. What kind of addiction? So if the person is addicted to alcohol, we could say alcoholism. If they're addicted to cocaine, we could say drug use addiction or drug addiction. Okay. If they're addicted to heroin, we could say heroin addiction. If they're addicted to gambling, we could say gambling addiction. If they're addicted to stealing, we could say kleptomania or addiction to stealing, or yeah. So probably it would fall more like in a diagnosis, but it's still a very general form, like a differential diagnosis. And we'd have to narrow down what kind of addiction. Good. Or smoking, right? So we often, in our list of problems, we have a problem list. If a person's a smoker, we list smoking. Okay? So that would be like a diagnosis. Good. Any other questions before we move on? Okay, should we move on? Can we, do you want to open, let's see, which is it? The HKU, it's DDX. Yeah, yeah, wonderful. I'm just going to fast forward this a little bit. Maybe not. Yeah, you've got to, do it on slideshow. That little guy down below. You have to go down below or there. Yeah, good. Down, this guy, huh? No, oh yeah. I bet this is working then. No, it isn't. Why isn't this working? Okay, yeah. I better suck on one of these guys. Good. So we started with this case study. Tell me what a case study is. Just give me a simple understanding of case study. What does it mean? Huh?
Deal with patient, study patient case.
Patient case, good. What else? It's a story. It's the patient's kind of medical story, right? Okay. Has a certain format. It's a story, a medical story. Okay. So this medical story or case study, 21-year-old Tibetan college student from Ladakh. I was called to see her in where she was living, and she was breathing so fast, she couldn't talk. So acute respiratory distress means she's, having trouble with her breathing. Okay? I have acute cough distress. With severe dyspnea. What's dyspnea? What's dys? D-Y-S. Trouble. Yeah, trouble. Right. Dys is trouble, difficulty, trouble. And Nia, P-N-E-A, means breath, breathing. It relates to the lungs. So whatever you see P-N-E-A, like in pneumonia, for example, It always relates to the lung. It's a Latin word. Okay. And tachypnea. What's tachypnea? Tachy? What does tachy mean? You guys that are race car drivers, what's tachy? Huh? Speed. Okay. It means going fast. And what's pnea? P-N-E-A. What is it? Huh? Can't hear you. Breathing, yeah, relates to the lungs. Good. Okay? Good. Good. Okay, so fast breathing. Okay? She was taken to the hospital. I took her to the hospital. And initially her blood pressure was high, 172 over 120. What's the normal cutoff for blood pressure? Below which is normal, above is high. What is it? 140, yes, over 90. Good. I want everybody to say that. What's the normal cutoff? What's the cutoff between normal and high blood pressure? Tell me. 140 by 90. Okay, I want everybody to tell me. What's the cutoff between high and normal blood pressure? Good. Don't forget that. Because you're going to take a lot of blood pressures, and the patient's going to say to you, "Doctor, my blood pressure, is it normal or high?" Okay? So now you know. Okay. What if the blood pressure is 140 over 90? What do you tell the patient? Huh? Huh? What do you tell the patient? "Doctor, how's my blood pressure?" It was 140 over 90. The patient says, "Is it okay or is it high?" What do you tell them? Huh? I'm glad you're not answering because it's tsatsam. Tsatsam. So we say borderline, 140 over 90. So you tell the patient it's right on the border, and we'll have to check it again, okay, to see what the trend is. You know trend? Trend? Mute. I mean, how it continues. Does it go higher, same, or go lower? We'll look at several different readings over time to decide if this is high blood pressure or not. Okay? Good. Her pulse was 170. What's normal resting pulse? Huh? Yeah, less than 100. And for most of us now, we're probably running about 70. Unless we had a bunch of coffee, or we just ran over here, ran up the stairs. Okay, then it would be a little higher. But for most of us, we're probably running around 70 or 80. If we're athletes, we run all the time, maybe our resting pulse is 50 or 60. You know, if you're a long distance runner, maybe 50 or 60. Okay. And regular sinus rhythm. If that refers to the heart beating on the ECG. Have you seen ECGs? You know this thing? Have you seen them? Yeah. So if it's coming regular, we call that sinus rhythm. If it's not regular and coming like bum 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 bum, what's that? You remember I mentioned it. I just mentioned it. Atrial fibrillation. AF. Atrial fibrillation. It just basically means an irregular, it's a little more complicated, but we won't go into that. You can basically think that it's an irregular heartbeat. Okay? There are other kinds of irregular heartbeats, but we're not going to do that now. Okay. So if it's very irregular, bum ba 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 bum 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 bum. Atrial fibrillation. Okay, good. What's CXR? What's that? Chest X-ray. Good. That's our abbreviation for chest X-ray. You may see that if you look at medical records. Okay. Showed significant pleural effusion. What's pleural effusion? What's plural? It's a PNEU word. Oh, sorry, it's PL. Sorry, a little different. That's the lining of the lung. The pleura is the lining of the lung, the pleura. Okay? So it means the lining of the lung, and effusion means what? Sorry? Yeah, water, liquid. Exactly, fluid. It has a lot of protein in it, but yeah, like water. So she's got water on the lung, okay? Actually, it's between the lung and the chest wall. That's the pleural space. Okay, so she's got fluid there. And cardiomegaly, what's that? Large heart, exactly. Cardio is heart, and megaly means big or large. It's got a big heart. Her exam revealed a prominent S3 gallop. You probably don't know that. S3 gallop, do you? How many of you are horseback riders? Anybody ride horses? Huh? Nobody anymore? We have one person riding horse. Great. I used to ride horse when I was a kid. I loved it. So how does a horse run? Huh? Gallops. What is the sound of a galloping horse? Da-dum, 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 da-dum. That's what it sounds like. And I put a stethoscope on her chest, and it was just sounded to me like galloping horses. Okay? We call it an S3 gallop. And that means congestive heart failure. It means the heart is failing when you hear that. You don't often hear it. In her, it was loud. I almost didn't even need my stethoscope. You know, da-dum, da-dum, da-dum. Normally, it should be bum-bum. It's da-da. So it's three sounds. It's da-da-dum, da-da-dum, da-da-dum. Three sounds. It just sounds like a galloping horse. You put your stethoscope on the chest, listen to the heart. Sounds like you're at the horse races, okay? And she had diffuse lower pulmonary rales, R-A-L-E-S, rales. They're crackling sounds. It means fluid in the lungs, okay? And we usually hear it at the lower part of the lungs. So here. Not here, but here, here, and kind of, you know, around here. Okay? Lower part of the lungs. And it means fluid, okay, in the lungs. You can hear it with a pneumonia. You can hear it with congestive heart failure. And there was significant diffuse, means all over, diffuse, all over. Peripheral edema. What's peripheral? What's peripheral? Excuse me? Yeah, dokchok kare. Dokchok kare. Dokchok. What's the opposite of peripheral? Huh? Peripheral's out here, so what's this? Central. Huh? Opposite of central. Peripheral means out towards the, the periphery out there. Edema. So, I'll show you a slide with this in a moment. With pitting in the legs. Pitting. What's pitting? Huh? Yeah, like a hole, exactly. I'll show you a picture of that in just a minute. Exactly. She was not putting out any urine. Okay. And then, after about a half an hour in the emergency room, she stopped breathing. She just got too tired. She couldn't keep it up. Breathing requires muscles. The muscles of the chest wall primarily. And she just fatigued. She got too tired and she stopped breathing. Had she done this at home, she would have died within a few minutes. We were very fortunate to have gotten her quickly into the hospital. And she was intubated. What's intubation? What is that? Huh? I heard it. Insert a tube. Who said that? Exactly. Where does the tube go? In the mouth, and then to where? Lungs, yeah. And the tube, it goes through what we call the trachea. Exactly. Yeah, good. And then that tube was hooked up to a machine, a ventilator, that artificially breathed for her. Okay? Placed on a ventilator. Her creatinine. Creatinine is a blood test measuring kidney function. Normal is 1.5 or less. She is 5.6, right? So her kidney function is probably somewhere around 10% or less. And what does the kidney do? What's the function of the kidney? Please? Please? I think you know. Please try. Function of the kidney. Can't hear. Supplying blood. Kind of. It's cleaning the blood. Yeah, cleaning the blood. And then the stuff that's cleaned out of the blood, then it comes out in the urine. Okay, that's how we get rid of it. Okay. The other way is in the stool through the colon. We can clean out impurities in the blood. Then we, chop some into the toilet. Okay. So her creatinine was very high, which means her kidney function was very, very poor. And she was dialyzed. Have you heard about dialysis? What's dialysis? Yeah, it's artificial kidney. There's a machine, and it takes the blood through the machine, and the machine takes out the impurities, just like the kidney normally does. And that's done in a patient whose kidneys are not working. Dialysis, exactly. We didn't know she would survive or not. We thought that she probably would die through the night. She just was too sick. Her kidneys were not working, and her heart was not working. It's very difficult to survive in that situation. She's young, she's tough, and she survived. Next morning, she could breathe on her own, and they extubated. What's extubation? What's that? Intubation is putting the tube in, so what's extubation? Yeah, removing the tube, exactly. Okay, so they could take the tube out because she could breathe on her own the next morning. Okay, that was the morning. That was four mornings ago. Okay, and she was sitting up. She was still having some trouble breathing, but not much less than when she came in. And I asked her if she had any pain. She had some tubes in. It was hard for her to talk, but she shook her head, know that she was not having any pain. Okay? And she's continued to do well each day since. She's continued to have dialysis, and her creatinine, the last one I heard was 3, but I'm sure it's below that now. I haven't heard for about a day and a half. Dialysis was continued, and now we're beginning to search for a family kidney donor so that she can receive a kidney transplantation. Okay? Her cardiac EF, you'll see this in records. EF stands for ejection fraction. What does that mean? It has to do with the heart. Ejection fraction. It basically means how effective pumping as a pump. If the ejection fraction is normal, the heart is pumping normal. If it's less than normal, the heart is not pumping so well. And in this case, her ejection fraction was 20 to 25%, and normal is above 55 or 60%. It's the percentage of blood that's squeezed out when the heart pumps. So normally you should squeeze out more than half, 60%. She was only squeezing out 20% of the blood, so very inefficient. Okay? Heart wasn't working very well. Okay, so this is a diagram of heart failure. Okay, and I just want to go over a few things. What I will do is I will make a copy of all these slides in PDF format. And then I'll send it to Professor Tashidabala, and I'll ask him to, have someone make copies for all of you. Okay? So you'll have copies of all the slides. Okay. So, Coughing. So some of these are symptoms and some of these are signs. So we'll review them. Coughing. What is it, a symptom or a sign? Is that something the patient tells us, or is it something we find on our examination, physical exam or laboratory? Which? Symptoms. Symptoms. Because the patient will say, I'm coughing. Okay. We can also observe it, but generally we call this a symptom. Okay. This is coughing. Tiredness. Symptom or sign? Generally a symptom. They'll tell us, but we might observe it also. So you might say it's a sign. We generally call it a symptom. Tiredness. Shortness of breath. Symptom or sign? Usually a symptom. They'll tell us they're short of breath, even though we can see it. Usually it's considered a symptom. Pulmonary edema, excess fluid in the lungs. How do we find that? How do we determine that? Put a stethoscope on their chest and listen to them breathe. That's one way. We could hear rowels, which means fluid. Okay? How else?
Ultraschall.
Excuse me?
Ultraschall.
Ultrasound could do it. The normal way we would do it with an X-ray, a chest X-ray. Okay? So that's a laboratory test. Okay? And then it would be a sign, because we found it on either our examination or our laboratory. Okay? So pulmonary edema or fluid. Okay? Then pumping action of the heart grows weaker. Okay? How would we know that? Huh? Sorry? Stethoscope. What would we hear? Huh?
The normal range of pumping.
Of pumping. What would we hear? You're right. Stethoscope. Listen to the heart. Huh? Heartbeat. Yeah. What would we hear? Sorry? Gallop. Yeah, we'd hear horses. Okay? Ba-ba-bum, 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 ba-ba-bum. Like I can't sound like horses, but we hear it sound like horses galloping, okay? We call that an S3 gallop. Okay? So we could do it by the stethoscope examination of the heart. How else? Ultrasound. We call it echocardiogram. It's a form of ultrasound for the heart. Okay? And we could see that the heart's not pumping well on the ultrasound for the heart. We call echo, means ultrasound. Cardiogram means heart. Echocardiogram. Okay? That would be a sign. Pleural effusion around the lungs. So this was pulmonary edema. So this is similar. This is very similar. But this pleural effusion is not in the lungs, but between the lungs and the rib cage, the chest wall. Okay? And again, that would be on the chest X-ray. Okay? Swelling in the abdomen. How would we figure that out? Maybe the patient tells us the abdomen is swollen, but basically on examination on this one, we would examine the patient. So that would be a sign, ascites, swelling in the abdomen. So fluid is collecting everywhere in the body because the heart is not able to pump the blood, so there's a backup of fluid. It backs up everywhere. In the belly, in the lungs, and in a moment we'll see in the legs. Okay? Oh, and let's see this guy. Swelling in the ankles and legs because the fluid again is backing up because the heart's not pumping properly. It's not pumping the blood properly. Okay? So this is all signs and symptoms of heart failure. We're talking about heart failure. Now, this patient has two problems. Heart failure and, what's the other one? Yeah, kidney failure we call it. Okay, so she has heart failure and kidney failure. Very sick. Okay. Here's just another kind of diagram or drawing. For heart failure. Some of these are not so, like dilated pupils, not so important. Color of the skin might be a little bluish, usually not. It's only in a very sick patient. Dyspnea. What's dyspnea? What's dys? Huh? Trouble, difficulty. Yeah. And nea means what? P-N-E-A means lungs. Yeah. So difficulty breathing. Good, good. And this is a new one for you, orthopnea. So pia means lungs, right? Related to the breathing or lungs. And ortho, you know what ortho means? Huh? Yeah, it does mean bone, exactly. This has a different meaning, though. You're right, it is. It also means bone, but here it has a different meaning.
Orthostatic.
So it means position. Position, okay? So it means if the patient lies down, they have very big trouble breathing. They have to sit up. So this gentleman's position is sitting, because if he lies down, he has more trouble breathing. Okay? And these are the crackles, which I called rales. The technical name is rales, R-A-L-E-S. Okay? That means fluid in the lungs. And often what happens is decreased blood pressure. So in our patient, when she reached the emergency room, her blood pressure was high. Okay? And the reason is she had a lot of adrenaline. She was extremely frightened. She was basically drowning. Okay? She had fluid in her lungs, basically drowning. And she was extremely frightened and wasn't really panicking, but tremendously frightened. So she had what we call an adrenergic response. It's like if a dog starts, coming at you and you think it's going to bite you or something, you kind of run fast because you have an adrenergic response, and it helps you kind of through a difficult time, okay? So that's what she had, and later her blood pressure fell, okay? So decreased blood pressure, because the heart just can't beat the blood properly to maintain the blood pressure. Sometimes, not usually, but sometimes there can be nausea and vomiting, okay? Ascites, we just talked about that. What's that? What's ascites? Fluid buildup. Stomach, yeah. We say in the abdomen. Exactly. Good, good. And dependent or pitting edema. What's that? Holes, right? Where? Yeah. So it'll look like a hole. I'll show you a picture of it in a minute. I'll show you a picture. The person is often very anxious. They're frightened because they can't catch their breath. The O2 saturation. Anybody seen that before? It's something we put on the finger these days. A little thing we just put on the finger.
I've seen it.
Yeah, you've seen it. Good. It just means how much oxygen is in the blood. Normal is 100% or almost 100%. 98, 99, 100%. But people like this would have 90 or 80, okay? Because they're not pumping their blood, so they're not oxygenating properly, okay? Also because their lungs are full of fluid, so they can't get the oxygen from the lungs very easily, okay? So their O2 sat, we call it O2 sat, falls, okay? They might be confused. Okay, I'll show you a picture of this. Jugular venous distension. It's the veins in the neck. Normally when we're sitting up, the veins are flat. When the heart is not pumping and fluid is backing up, the pressure goes everywhere, including in the neck veins. So they get very big, even when the person's sitting. Okay, I'll show you a picture of that. This just means a heart attack, but we're not, in this patient, we don't have a heart attack. We have another reason for the heart failing, which we haven't actually decided yet. We're still investigating. We don't know. Person becomes very tired or fatigued, okay, symptom. S3 gallop. There we go. What does that sound like? Horses, yeah, sounds like horses galloping. Good. When we put the stethoscope there, right? And tachycardia, we'll hear the heart going fast. What's the cutoff? Tsatsam? For resting heartbeat? Huh? Excuse me? 140/90 is blood pressure. That's correct. blood pressure. But here we're talking about the pulse. The pulse is how many times the heart beats in a minute, called the pulse. What's the normal? Satsang. 100, yeah, 100. Okay. So in this case, tachypnea means fast heartbeat. It would be more than 100. Okay? Enlarged liver and spleen. We couldn't check her, but I'm sure her liver and spleen were big. Decreased urinary output because they're just not pushing the blood through, so the kidneys are not working. And she had that. She had, in fact, no urinary output for quite a while. And a weak pulse because she doesn't have good blood pressure. So when you put your hand on, for example, the radial artery, rather than boom, 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 it's like boom, boom, boom. Not very strong. Okay? Good. Okay, what's this? Huh? Chest x-ray. Yeah, chest x-ray. Okay. What do we find here on the chest x-ray? This is a patient, it's not our patient, but it could be. Okay. In a woman, you see soft tissue. You'll see an outline of a breast here and here, which you don't see. So this is most likely a man. But what do you see here? Any idea? What are we looking at? Heart, good. What else? Lungs, good. Mainly those two things. There's some bones and a few other things, but mainly we're looking at the heart and the lungs. Okay? Tell me about the heart. How does it look to you? Is it small? Is it normal size? Is it big? If you had to take a guess, what would you say? Huh? Somebody says small. Anybody else? Big. It's big. You wouldn't know that because you haven't been looking at x-rays. This is a big heart. It starts on probably right there and goes all the way to somewhere. We lose it here. That's big. Anyway, take my word. It's big heart. Okay? And what about the lungs? Normally they're all black like this. But what do we see? All this junk, all this white stuff. What is that? Yeah, fluid, water. Not exactly water, but yes, fluid. Has protein in it. Okay? Technically, it's plural fluid. Okay, technically. But like water, yeah. And normally, we'd have a sharp angle here. Okay, black sharp angle. But we don't see it. It's rounded. See, it's rounded there. And here we kind of don't even have any. All fluid. That means fluid in the plural fluid between the lung and the chest wall. Okay? So those are, and then we have all this stuff in here, which means congestion in the arteries, in the pulmonary arteries as they branch out. Okay? So this is all congestion in the arteries, all this stuff. Okay? So that's a classic x-ray, chest x-ray for heart failure. Sometimes we call it congestive heart failure. Sometimes the newer form we just say heart failure. We don't use the word congestive, but either way. So we abbreviate it as CHF for congestive heart failure, or now more and more we're just using HF, heart failure, HF. Okay. Okay. Jugular venous distension. Oh, the N got moved over there. Okay. What position is the patient in right now? Huh? Is he standing on his head? What position is he in? Resting, but what is he? Lying down, sitting up? Sitting up, yeah. It looks like he's sitting up. We don't see the whole picture. Yeah, he's sitting up. Okay. So, do you see this vein? This is the jugular vein. It's a superficial neck vein. Normally it's flat. In you and me it's flat. Here it's distended. It's big. Why? Excuse me? Why is it big, distended? What's wrong with the guy? Take a guess. Maybe he has heart failure? Yeah, this is one of the signs, so something we find on physical exam, of heart failure. JVD, jugular venous. It's the jugular vein. Distension means big. Okay? Sitting, in a sitting position. Okay. Good. Okay. Holes. See the holes? These are the holes. It's where the person puts their thumb, just to check. In you and I, it would be flat. Or maybe after a long bus ride from, Dharamsala or something, it might be a little bit of, pitting, a little bit of edema. But this is quite serious, right? You can see the ankles, the legs are quite swollen, and these are pitting. So when the thumb is put there, it stays there, kind of like a hole or a divot or an indentation, okay? And that we can see it with many disorders that create edema or fluid, but also we see it both with kidney failure and with heart failure, okay? Peripheral edema or pitting edema means it just makes kind of a hole when we push it with our thumb, okay? Okay, I think I'll stop here. We won't do physiology today. We've done a lot. And let's maybe have some questions, please, or discussion. And then tomorrow, we can go in a little bit and talk about what's happening, the physiology. I'll explain what that means. And we'll talk about a little of the physiology of heart failure. Okay? So, please, if you have any questions, please go ahead. Not bad. I didn't cough. I think once. I think Kasser is really doing well for me. Good. Yes, please. Jugular vein. The question is, does it have something to do with oxygenated or not oxygenated? Very good question. So it's a vein. So the two kinds of blood vessels we have in the body, we call arteries and veins. Do you know the distinction? Tell me. What's the difference? Please, please, please. Oh yeah, thank you. Thank you, Lama. What's the difference between artery? Let's try this one. I think we've just lost our testing. I'll turn it off and try it again. Is it working now? There we go. I think the battery must be getting low on this guy. What's the difference between an artery and a vein? Someone tell me. Tell me what the difference in how they appear and also their function. Their anatomy and their function. What's the difference between the anatomy, artery and a vein, and the difference between the function of an artery and a vein? What do you think?
Normally,
Yes, please.
artery carry blood away from the heart.
Good. Normally, artery takes the blood away from the heart. Very good.
And a high blood pressure.
Uh-huh.
And a high rate, and the vein
Hmm.
is opposite.
Good. So the veins returns the blood back to the heart. Very good. And what's the function then of the artery and the function of the vein? I think you said it, but please repeat. The function.
Function.
Yeah, of the artery and the vein.
Artery carry blood.
Huh?
Carry blood from heart to the rest of the body.
Good. So the artery, the function carries the blood from the heart to the rest of the body. Good. And the vein?
Then it's just opposite.
Opposite. It brings the blood back. So what about oxygen? Artery oxygenates the blood. Exactly. What does the vein do? Sorry? I'm sorry? Deoxygenating blood. Yeah. The vein is bringing the blood back to the heart that has already been deoxygenated. So when the blood goes out to the body, pumped by the artery or taken by the artery, then the body, the different tissues and organs, they take the oxygen out of the blood. Exactly. And then when the blood returns to the heart through the veins, it's deoxygenated. Very good. So what's the color? What's the color of the artery and what's the color of the vein? Huh? So this is my vein right here. What color is it?
Artery is red.
Artery is red. Good. Why? Oxygen. It's rich in oxygen. Good. And the vein is what color? Blue. Why? Huh? No oxygen. Exactly. Good. Okay. Now, the anatomy. What's the difference between the anatomy? If you cut cross-section, a vein and an artery, what's the difference? Artery is doing more work, isn't it? Because it's pumping that blood. It's under higher pressure, right? From the heart pumping the blood out to the body. So what's going to be the wall thickness in an artery? Thin or thick? Raise your hand if you think it's thin. Artery wall is thin. Raise your hands. Just raise your hands if you think so. If you think the wall is thick, raise your hands. Yeah, it's thick. Good. And what about a vein? Is the wall thick or thin? Thin. Raise your hand if you think it's thin. Yeah. Because it's not doing much work. It's more passive. The vein, it's just bringing the blood back. Whereas the artery is pumping it out under pressure. Okay? Very good. Excellent.
And the veins have some claps.
Yes, the veins, if they're not full, they collapse because their walls are kind of thin. Whereas the arteries, if they don't have blood, they don't collapse because they're thicker walled. Good. Okay. Other questions? Or doubts? Maybe some areas that are not clear? That's a perfectly good question, yeah? Please explain, I didn't understand well. It's a wonderful question. Are you thinking about the basketball match? Please, yes. You want to maybe send back a microphone? Thank you.
Hello, sir. I just wanted to ask if there's a difference in percentage of men having more cases of heart failure than women, or is there any difference?
Wonderful question. The difference is men versus women in heart failure. You know, the numbers used to be more men, but women are catching up. And one of the main causes is heart attack. Not in our 21-year-old girl. We still haven't determined the cause of her heart failure. But in general, heart failure is mostly caused by heart attack. Who gets more heart attacks, men or women? Huh? Men, yeah. Why? They're more angry. It's true. Women get angry, of course, but men tend to be a little bit more angry in general. Men tend to smoke more. Now more women are smoking, but they tend to smoke more. And in the past, more men were working, but now it's getting more towards equal. Yeah. And when you work and have a lot of tension, it tends to elevate your blood pressure. So high blood pressure, is one of the causes for heart attack. And it used to be more in men. It's becoming a little more equal now. So generally more men, but women are catching up in terms of heart failure, incidence or prevalence of heart failure. Thank you. Please.
Is there maybe a cause too with the hormones between the women and the men about the heart attack?
Hormones in terms of heart attack, not sure. One thing we do know is that estrogens, women have higher estrogens than men, can cause blood clots. So in the past, birth control pills that contained a higher rate of estrogen have now, that estrogen dose has been reduced because some women will get blood clots. But that's different than heart attack and different than heart failure. So I'm not aware of a hormonal difference, men and women, having to do with a causation in heart attack. I'm not aware of that. There might be some, but I'm not aware of it. Yeah, good, good. Yeah, good thinking, because sometimes we consider testosterone to be aggression, and aggression, heart attack. It's very good thinking. I'm not aware of that difference, but it could be, could be. Yes, please. You want to go enjoy the rest of your Indian Republic Day? Everybody else is having a holiday, huh?
Sir,
Yes, please.
is there a difference in the shape of heart to men and women?
Very good. Shape of a heart, difference gender-wise.
Because in our Sowa Rigpa it has said that the peak of the human heart is little turned to the left side, right side.
Right side and the
I'm in doubt whether the shape there is difference in that.
Yeah, good question. I don't think there's a difference in shape between men and women. Yeah. Generally, the size is proportionate to the body. And generally, men are bigger than women, but, not always, of course. But that's not the shape, that's the size. Would be proportional to the size of the body. But the shape is generally, as far as I'm aware of, the same in men and women of the heart.
But the peak
In heart failure, we often get a change in the shape of the heart. So you may hear the radiologist in the report on the chest X-ray say the heart is boot-shaped, B-O-O-T, like a shoe, hamko, like a boot. It kind of comes in more like that, kind of comes down more like that in heart failure. But gender difference, I'm not aware. Interesting that there is in Tibetan medicine. Yes, please.
So do you think the risk is much more higher if you did in the past, when you was young, maybe like me, I did every day a lot of hours sports. I was a sportsman in school.
Yes.
And then I had some operation with my ankles, with the knee and other things. So I have to stop immediately my sport, and normally 3-4 hours every day I had training.
Yeah.
So is the risk to become some trouble with the heart higher then?
No, actually the opposite.
Really?
The fact that you were a sportsman for some years and did 3 hours of vigorous exercise or athletics a day is prevention from heart disease.
Yeah.
So if anything, you probably have some prevention because of your past history of being a sportsman. If you continued to be a sportsman, you'd have even less of a chance. But, with your history of some years of being a sportsman, less of a chance of heart attack and heart failure.
My thinking was when you stop immediately, when your body was trained many years,
Right.
and from one day to the other day you
Right.
stopped immediately.
Right.
Is, I think maybe a risk for the heart because there's a different pressure now, not so hard working.
Right.
So maybe you become some troubles, but I have no idea about this. Maybe.
I don't think so. It's a good question and good thinking. The heart's very resilient, as are so many of the organs in the body. Very resilient. So I think that abrupt change from strong, vigorous exercise to no exercise, I don't think that would create a big problem for the heart, if everything else is pretty normal. Yeah, good, good. Okay, well, that clock continues to be wrong. I think it's not moving, huh? It needs a new battery or something. Yesterday it was the same time.
Dr. La,
Yes.
before we studied a case of a patient where a patient has a failure of a heart and kidney both. So,
I'm sorry, failing of a heart
and kidney.
and kidney, yes.
Yeah. So we can see that she has a problem of, she has some signs like pitting edema and the distension in the jugular veins.
Yes.
So is it because of that, is it because she has a problem in circulation of blood and there is no more supply of oxygen in the blood? Is it because of that?
Yes, it's more the circulation part of things. She's not adequately circulating her blood.
Okay, so
Why is she not adequately circulating her blood? Why not?
normally we say that when the exchange of a gaseous exchange, we say
Yes.
between CO2 and O2.
Yeah.
The gaseous exchange
Yeah,
takes
yeah.
place in the lungs.
Yeah.
So in her case, she has a pleural effusion. So that's why it may be because of that.
Yes. That's true. The circulation problem of the blood is because she's not pumping. In order for us to circulate our blood, we need to pump. Okay? It's like if you have your water supplied by a well underground. Because of gravity, you're not going to get the water, right? So what do you have to do? You pump it, right? You have to pump it. Same thing in the body. To get the blood circulating, it won't happen automatically. You got to pump it. And what happens if your pump is not working? You're not getting good circulation. And therefore, backup of fluid, therefore pitting edema, pleural effusion, JVD, jugular vein distension. Okay? So this is more because we don't have good pumping action. What you say is true about the exchange not working well, CO2 and O2, but that won't have a direct bearing on the circulation. Yeah, good. Good thinking. You guys are really starting to jump into this. It's great.
Is it
Please.
possible that the liquid from the kidney disease and will press down the pumping from the heart? This is one reason that too much liquid is in the body and press too much on the heart, and this is maybe a reason that the blood pressure is very low.
Good. Very good question. That's what we originally thought. But then we found out with an echocardiogram that our heart also wasn't working properly. So two things. Two things are creating a problem with fluid overload. The kidneys, normally you pee out, the fluid that you don't need, but her kidneys aren't working, so she's not doing that. So there's a fluid buildup because she's not getting rid of the fluid through urination. Okay, number one. That's a kidney problem. Then her heart's not pumping well, so the blood and therefore fluid is backing up. And so some of that blood, the fluid part of the blood, leaks out of the arteries, okay? And it goes into the lungs, pleural effusion, it goes down in the legs, okay? If she was always standing on her head, she'd have a big head. She'd have swelling in her head. So it's dependent edema in the legs, because normally we're upright. Okay, just gravity. Make sense? Sort of? Good. I've presented a lot of material, and I think you're understanding at least some of it. It's wonderful. Good. Please.
You said that jugular venous decision. You said that actually the jugular vein, the normal shape of jugular vein is flat and it changes its shape due to the problems in the heart. So what actually is happening with the jugular vein after all? Is it due to blood clotting or a plaque?
Blood clotting or
Plaque.
Blood clotting does happen in the veins, generally not in the arteries. It can, but generally, most of the time, if you get a blood clot in the circulation, it's in the veins. Plaque happens in the arteries, not in the veins. So it's neither of those, okay? It's just because the fluid is backing up. If the pump is not working, okay, we've got all this fluid, blood and other fluid in the body, the blood's going to kind of back up because it's not being pumped properly. And what's going to happen is the fluid in the blood's going to leak out of the arteries, okay, and go into the tissues. In the legs, edema, in the lungs, we get pleural effusion and we get water in the lungs, okay? And so because of that pressure, because the heart's not pumping well, the pressure backs up. So the blood returning to the heart through the veins, it's going to be backed up. And that's what the jugular vein is doing, is trying to return the blood back to the heart. But the heart's kind of not pumping its blood, so the blood's backing up. And that, therefore, the jugular vein is getting more fluid, more blood, and distended, getting big. Make sense? Good. Same thing in the belly. You may get ascites. Same thing in the lower legs. We may get the holes, pitting edema. Just fluid is backing up. Good.
So the lymphatic system is had the same result. So it's swelling because the filters are blocked like this.
Yeah, the lymphatic system works very closely with the venous system. It drains things kind of back generally. There are also nodes in between in the lymphatic system, and they will be swollen also. We won't know that because we can't see it with our eyes generally, and we don't have easy tests to determine that. Whereas with the veins, we can see it, like the jugular vein. Yeah, good, good. So both will be backed up and swollen, lymphatic system and venous system. Okay, I think we've, what time is it? Almost 4, so we've gone a little over time. Any other last questions, or should we leave stuff for tomorrow? Any other last questions?
Thank you.
Thank you.